Hi, everyone. Thank you for joining me today. Today, we're going to talk a little bit about the pledge that we're doing, about changing the language that we use and how much words matter when we're talking about substance use disorder, and talking about that this week for Nebraska Drug Overdose Awareness Week. So today I have Chris and Tasia with me. Both of them are from the Wellbeing Initiative. And I am lucky enough to get to do quite a bit of work with the two of them, actually. And all three of us actually were involved in sort of talking about this pledge and why we wanted to do this and why words do matter. So I'm going to start with Chris and have him introduce himself and tell us a little bit about the Wellbeing Initiative.
Wonderful. Thank you, Amy. So yeah, like Amy mentioned, my name is Chris Allende. I, along with Tasia, work at the Wellbeing Initiative. My title there just recently changed. So let me see if I can remember. It is Training and Technical Assistance Coordinator. That's me. So I do a lot of our training, as the name would suggest, and also really trying to expand the technical assistance branch of the work that we do, supporting organizations and businesses, implementing, sustaining peer support, as well as a culture of whole health and wellness and organizational peer support. As far as the Wellbeing Initiative is concerned, we are a peer-run organization. So what does that mean? Great question. It means that we all have lived experience with mental health and or substance use challenges, from the CEO all the way through every one of our staff. I myself personally have been on my recovery journey for about, oh goodness, it'll be 18 years now in December. So it's been quite a while, and I'm thankful for what recovery has brought me. We consider ourselves, the Wellbeing Initiative, to be a training, education, and advocacy organization, and we also provide direct care. So that's in a nutshell what we do. I could literally present about it for an extended period of time, but I'll spare all of us that and just pass it on over to Tasia.
Okay.
My name is Tasia Brummagem. I am the Workforce Training Coordinator at Wellbeing Initiative, certified peer support specialist. I have lived experience with substance use and mental health experiences. I've been on my wellness and recovery journey since August 8th, 2016. I have experienced 2 overdoses when I was actively in my addiction with substances. And my role in the community is I train participants, people, humans who want to become certified peer support specialists. I train them to become certified peer support specialists.
Very cool. Thank you both for being here. And I can't say enough about the Wellbeing Initiative. I recommend it to a lot of people. I think it's great. There's so many great people there. It is great because it is people who have lived experience, and so that's a lot easier for people who are going through recovery to actually have someone who understands and has been in their shoes before. And so it's just a great organization. So we're going to talk a little bit about the pledge that we're doing. So on stopodne.com right now, you can jump on and take the pledge, which we ask everyone to do. It doesn't matter whether you know someone that's actively using, in recovery, not at all. I think everyone should do it, just because with a lot of things, we just need to change the way that we talk about different issues. And I think it's also great if you start to use the same phrasing, the same words. It's also great for other generations to realize that that's how we're going to talk about those things, that subject, and less judgment towards people. And even if you're not in the state of Nebraska, take the pledge anyway. It doesn't matter. You don't have to be here. Words matter everywhere, not just here. So, and when you go on and take that, it's really changing, like I said, the words that we're using every day. So you'll hear a lot. And I'll say it took me time too. So it's going to be something that takes people time to actually change the words sometimes. Even when people are taking the pledge, there's a spot on there to say kind of why you're taking the pledge. And as people are, and I've gotten so many great stories of why people are taking the pledge. And a lot of it is people like us that are working kind of in that space. But then it's a lot of people, some people who've lost someone or have someone who's actively using. But even in some of those, I noticed some of the words that people use. And it took me a while to be able to say substance use disorder. And now that's just kind of a normal word for me to use instead of saying someone who's addicted to drugs. And so I guess either one of you jump in whenever you want. So why is it so important that we change the language that we're using?
I got a lot of thoughts on that. Asia, do you want to start? You want me to start?
Chris, you can go ahead and start.
Okay. So can I give a little bit of history?
Yeah.
When we talk specifically within the world of behavioral health, right? So we're talking mental health and substance use. For a long time, when we look at the history of it, there has been a lot of stigma around it. There has been a lot of stigma around having mental health challenges. There has been a lot of stigma around substance use and addiction in general. And for a long time, the challenges that we faced is being kind of ostracized within the community at large, right? And the words that were used to describe people that had these challenges were very negative and stigmatizing in and of itself. I mean, I think about somebody who experiences a reality that's maybe different than the traditional reality, right? Somebody who maybe has something like schizophrenia, for example, and how there's so many words that have been used to really just demean and again ostracize an individual with, let's say, something like that that's going on, to the point where it's even been used, like that diagnosis has even been used as a derogatory term within the community. It's been used to make fun of other people who maybe don't even have that experience. Right. So it's, for a long time, it's been something that has been extremely, extremely just stigmatized and used very negatively. So let's fast forward a little bit. A while back, I'm going to say several years ago, then we came into kind of this whole person first language, right? Where we started putting the individual before the diagnosis, where we started, instead of saying that person is an addict, that person is, sticking with the example that I gave of schizophrenia, that person is schizophrenic, that person is a homeless person, for example. We started then using the individual's personhood before their diagnosis or their experience. In the case of somebody with an addictive behavior, it was that person has a substance use disorder, right? Person first, instead of that schizophrenic, which, just saying it, I cringe inside. But for the point of this education, I want to make it as plain as possible. In the case of that one, it's, somebody who experiences schizophrenia. When it comes to homelessness, somebody who experiences homelessness. Now there's another move within that specific world talking about the unsheltered. Right. So again, we had this whole move of person first, where we put the personhood before, wait, I guess it's mirrored here. But anyways, we put the personhood in front of the experience. Now there's even another move, another kind of wave that's happening that I tend to like a little bit more, and it's person-centeredness. There are some spaces in which that population identifies very strongly with the diagnosis or the experience. It's such a big part of who they are that they want that to be a part of who they are. It is a part of who they are. So now we're shifting into this thing called person-centeredness, where we start talking about the individual first and addressing them how they want to be addressed, where it's not necessarily person first, but it's the individual. It's centered around the individual. And I've heard lots of webinars where they explain it, and I think it's a really fascinating take. A doctor that I was listening to mentioned something about the fact how her diagnosis is a part of who she is, and that if you need to put her personhood in front of the diagnosis to remember she's a person first, then we got some bigger problems than just the language that we're using. So I thought that was a very interesting take.
Yeah.
Long explanation, but basically there's been such history with the words that we use being changed and morphed to be negative and to cause harm, that we're really trying to create awareness that the words that we use actually matter. They do, in fact, matter. And just for people to be aware of that, the same way I wouldn't, friends of mine, family members don't necessarily want to be treated by their medical diagnoses, just for an example. It's the same with somebody who has a substance use disorder or somebody who has a mental health challenge. Like, I am more than the addiction that I am overcoming. I am more than the diagnosis that has been placed on me. So just being cognizant of that. I'm very much a believer that a diagnosis is simply for the payer source, right? The insurance companies need it in order to pay the fees. But as an individual, we are so much more than that. I'll get off my soapbox, Tasia.
I love everything that Chris just shared and giving the examples that he did. It really is about like reducing the stigma, not only for the community, but within ourselves. It is, we've heard the words, right? And it's, for someone who, like me, who has experienced substance use and mental health, how can we talk about each other? How can we come together to reduce the stigma? Every time we talk about it and bring substance use or mental health or trauma or overdose or anything that has to do with the behavioral health field to the light, and how we talk about it with compassion and care and kindness to the world, we reduce the stigma. And a big part of doing that is, how can we say it in a more kind way? For example, right? I was watching a TV show, and within the TV show, it was referring to someone as a junkie. And it, like, my feelings were hurt. I'm like, dang, like, I'm around all these junkies or these junkie people. And I'm just like, dang, like, it was cutting me. It was hurting my feelings. And I was literally just watching the television. And it just, how can we give more kindness and compassion to anyone who experiences substance use or mental health? By putting the person first, or not, calling someone by their diagnosis, or even using it in a derogatory term, and the word crazy is thrown out there, and so many different aspects. The weather is crazy, or dang, that's so crazy. And that can be used in a way that can hurt. And you just never know who you're sitting at the table with. You could be at a family gathering. You could be at an event for work, and you could be sitting at a table having a conversation, and you don't know what that person has experienced, or what their family has experienced. So utilizing the words in a more kind manner that brings the community together. So someone who does experience substance use or mental health, or knows someone or has those feelings, don't feel so isolated from the outside world. That is why words matter. Just inclusion and advocacy, and just like reducing that stigma. The way I advocate is like, one day in a perfect world, or one day in the world, there will be no more stigma. So like it just, the ripple effect, it just starts with us, right? How can we change our words?
Right. And that's, I feel like, when you were bringing up like a television show or something, and I think that's the thing. It's like, because we're so used to like, oh, here's what, that junkie looks like, or here's what, and so it does have this whole connotation, I think, to what that person is supposed to look like, when it looks like, oh, any of us, it can look like anybody. And I was kind of thinking about it this morning, because my ex, he would always refer to himself as a junkie. Even when he was in recovery, he referred to himself as that. And I kind of was thinking about that this morning. I thought, is that also because he thinks of himself negatively, is what I was thinking, instead of him thinking of himself just as someone who has lived experiences in recovery, and, and he's struggled back and forth. But my thought was on that, because it would always make me feel like, when he would use that word, I was always like, oh, and this was before I was in any of this space as work, and I would always feel like, oh God, okay, now everyone, because I knew everyone was judging at that point. it didn't matter how nice they knew he was or anything. It was all of a sudden like, oh, okay, that's who he is or was or whatever, you know. And so it's just such like a bad vision that we have in our head when we use those words.
And Amy, sometimes it's like we get trained so much, throughout the course of our lives. So it's like I think about the child who has been told from a young age that he's a loser. That child will grow up believing that they are in fact a loser. And I feel like there's so much social conditioning that happens with that, that once we're told this for such a long time that it really does affect the view even of ourselves. And then we attach who we are to that. And even in recovery, we still consider ourselves to be a junkie because our whole being is attached around this label that we've heard for such a long time that we are. So I think that's another reason why words matter, because it can really change the perspective about how we feel about ourselves. The things that we hear day in and day out do tend to affect us. And some of those labels end up sticking whether or not we want them to. I do really strongly feel that that's another reason why they matter. And when we talk about, self-stigmatizing language, I feel like for Chris personally, one of the best ways that I can model the fact that words matter is the way that I identify myself. One, so how I self-identify, how I talk about myself, that models the fact that words matter. But also when I talk about others, like what Tasia was saying, just being cognizant of the words that I use can really change at least the little microcosm that's around me, right? My scope and my sphere of influence. And it happens to me often when I talk, I'm in lots of different spaces. I have this conversation and there'll be individuals that I'll have talks with on the first time and they'll notice a shift in my language. And sometimes the question will get asked, hey, so I heard you saying this, how come? And then that grants me the space to be able to actually explain why I said the way, or the words that I said the way that I said them. So I feel like there's levels to it, right? Like first myself, then my sphere of influence, and then I think the greater sphere.
Right. Yeah, it's like when you were doing that, I was like, yes, it's almost like an onion that we're trying to peel all of these layers away. And I think like you were saying, it is hard, especially, and just with my experience with my ex, he did have a lot of trauma in his life. And so I think, yes, when you've already been put down so much in your life, and then you're also see yourself as just a junkie, I think, that is because years and years of people, saying negative things to you. And then you're like, okay, now I'm also this. And so it's hard to get over that, without, lots of help to see yourself as something other than that then, because the world should see, him other than that also, because that's not just who you are, yeah. So Tasia, tell us a little bit. So when you were either actively using or even in recovery, when did you start to notice that those words did matter to you? How, like you were saying, you were watching a TV show, so that you were noticing like, okay, I feel negatively towards this, or how people are referring to me, or how you're referring to yourself, maybe even.
Yeah, I think even like when I was using, when I got like arrested, and I was referred to as an inmate, even at that time, I felt like, it started to affect me then, being referred to as a number, or, inmate number, or not even being referred to as my first name. They would call by your last name or inmate number. Um, I just felt like I was like not really human anymore. And that's kind of when it really started to affect me, and then throughout like my recovery process, like getting into treatment, and starting to really gain some like understanding of like some confidence and like some self-love and like support from others in the community. It was like, okay, like I'm not the only one. I have a network of support and community, that I really started to understand that like I don't have to walk this path alone. And like I really wanted to change from the time someone got arrested and was referred to as an inmate number, that they never had to feel like they had to be just a number or an inmate or a junkie or, you
Mhm.
know, ever their diagnosis and have to feel that way again, you know? And so one thing that I truly believe is like it has to start there, you know? So
Mhm.
like educating and really like talking with the first responders or anyone at that point and just continuing to like talk to others about it. Cause a lot of times we don't even know, you know, it's
Mhm.
just we don't know that words matter unless we talk about
Right.
it. You know, I mean, it's just it's a thing. It's just, you know, it's you know, we just I don't blame anyone or any certain person. It's like we just need to keep talking about it. Like, hey,
Right.
that
Yeah, it's
hurt.
just what we've been taught to
Yeah.
say. It's just how
Yeah.
what we know to say. Yeah.
Yeah. And so it really just starts with us, you know, continuing to just change the language. And a lot of times, like, I heard other people use like person first or person centered language, and then it was really catchy. And it
Mhm.
was like where I went to a treatment center at, we were referred to as like clients. And then I went back to, you know, in the atmosphere there, and it was no longer the participants or individuals or humans or people were referred to as clients anymore. They were referred to as like participants or humans or people. And I'm like,
Mhm.
wow, that's a game changer. Like I'm a
Yeah.
human. Because even if like sometimes the word client, it feels like almost like a number also. Sometimes even like where I'm at on my wellness and recovery journey, I can correlate inmate with client. I just the number thing there, you know, and
Mhm.
so then I go back and forth with that with my trauma, you know. So
Right.
um and it's I'm really big when I hear people refer to themselves as like junkies or when they're still using that language and you know, I'm really big in like give yourself some grace and compassion, you know.
Okay. I like
Um
that. Yeah.
give yourself some grace and compassion and just sharing my lived experience with how the verbiage and the changing the language has really supported not only me but like starting within the household and my family and my children and having
Mhm.
like their outlook on like addiction or mental health and being able to have the confidence to talk about their feelings of mental health and substance use with me because they feel comfortable because I
Mhm.
like they tell me all the time it's like wow you're really nice about people with mental health or substance use mom you really are nice. I'm like yeah it's compassion.
Right. And that makes you wonder if they think that there are either people aren't nice about it then, or they do see it as a negative thing, which I think with mental health, we are getting a little bit further along anyway than we used to be anyway, and hopefully we'll get there with substance use also. But
Yeah.
I think also with kids, I think that is one of the big things is just making sure that they also know the language to use, whether that's just so if at some point they needed help, they would get help, whether that's mental health issues or with substance use, just so that they would, go and ask someone for help or be that person for someone else who someone else could come and ask them also for help. One of the things, and I don't know, and this is kind of a thing I always go back and forth with, and maybe Chris or Tasia can jump in on it. So, being someone who is kind of on the other side of that, as someone who lived with someone who was actively using when I first met them, and then kind of went through that recovery journey with them to kind of get them on that path. One of the things that I've noticed, and I'm still friends with my ex, and he's gone in and out of recovery, and also. I'm going to say be homeless, Chris, because now I can't even remember the word I was supposed to say. So I need to work on that for that part of it. But one of the things I think that people see as a struggle, because I have been where he was in recovery, we went to a hospital, he told someone that he was in recovery, but he used to be a junkie, and then the dynamic changes. And I know that also when he has been actively using, he was a different person than he was when he wasn't actively using, which I'm sure that's a common thing. But I think that's where like health professionals, they are kind of used to, I know they've seen him as the person that is actively using and isn't cooperative and, isn't super great to the nurses, maybe that are in the emergency room, but then the person who is in recovery. And I think sometimes for those healthcare professionals, it's hard for them to, do you get what I'm saying? Kind of know, like they've seen that person when they're at their worst. And that's a hard person to deal with. But then when they've got that person who is in recovery, it's almost like they still treat them the same way. So what advice do we have for people who are kind of in that situation? I don't know if that makes sense at all, because it is kind of dealing with two different people a lot of times. And he also hasn't been the best when he's, had police interaction if he's, actively using at the time, or, those sorts of different things.
Yeah, that's a hard question to answer. I guess for me, it's one of those things that it goes back, and I'm not saying that this is going to be easy, right? I don't ever want to say that it's going to be easy, because a lot of this is challenging and it requires reprogramming ourselves to things that we've been taught and have learned for so many years. But I guess it goes back to a lot of what Tasia is talking about the grace and the compassion. I have myself, because I think oftentimes what happens is folks, we kind of get in our zone of what we're doing, the work that we're doing, whether it is like a nurse at the ER, or whether it is a law enforcement officer. And we can sometimes throw people into groups and throw people into lumps of situations, and forget that each interaction can be a new and a different interaction, and that each individual, doesn't necessarily they aren't necessarily the same person that they are today that they were yesterday. That being said, I get how challenging it can be if John Doe came in yesterday and they were under the effects of whatever the case might be, and they treated a certain way, they treated you a certain way. I could see how that would kind of cloud your judgment on how you're going to treat them today. And that's, I think, a very real human response. And I don't know that I have a great answer for how can you shift somebody's perspective on that. In my case, what worked was time. If I had an interaction a while back with somebody, then I would gauge today and see where they're at. If it's really close back to back, I don't know that I have a good answer for that, Amy. Tasia, any thoughts?
I think it's just continuing to use the language that we know, like the words matter, the person first language, the person centered language, and just hope that others catch on.
Right.
Education, if someone asks like why we use that language, I'm very open to having that hard conversation about like, hey, well, like I am in recovery. Like, did you know? Right. And I think that it's like continuing to share our lived experience, which is why peer support, I think, is so important. And having conversations like this, like, hearing stories of like family members, friends, and peers who are on their wellness and recovery journey, just continuing to share, right? Taking the vision of what the junkie looks like, what it's been portrayed on the television, and switching the game up to the stories of hope, right? It doesn't always have to look like this,
Right.
and just, just switching it up, man.
Yeah.
Can I add one other thing?
Yeah.
As Tasia was talking, it made me think of a scenario. I think another one of the things that's most important for me, and again, I'm not saying that it's going to be easy, but just to remember that all individuals deserve dignity and they deserve respect. I a while back was supporting an individual who had a substance use issue, and this individual would go to the emergency room quite often. Fast forward a couple of years later, when they're in a relatively good space, they were going and applying for disability for mental health purposes. And when we received all the documentation, that the hospital had as a means of, making the file so that this individual could request disability. When I saw the language that was used to describe this person in the medical file, I was flabbergasted. I was in shock. I was like, oh my goodness, that's terrible language. And it really, I think that the nurses' frustrations, the doctor's frustrations with this individual was very evident in the way that they were written about.
Mm-hmm.
Which I think for me speaks of a couple of things. Some of these fields are extremely taxing and they take a huge emotional toll on us.
Mm-hmm.
So when we talk about peer support specialists, we talk about self-care and like, are we taking care of ourselves? I would throw that and, just have that conversation with individuals that are also in whatever helps field, whether it's law enforcement or whether it's the medical, like nursing, things like working at an ER. Like, take care of yourself, because when you start to feel those symptoms of burnout and
Mm-hmm.
compassion fatigue, it becomes evident in a lot of different spaces. And when I was reading the file on this individual, what came to mind is, oh my goodness, I wonder what this nurse was doing to take care of themselves, because they don't seem like they were in a very good spot,
Mm-hmm.
just by the language that they were using. So again, just the importance of dignity and respect, and oftentimes that comes about with the language that we use and the words that we choose.
Right. Yeah, that's a good point, Chris. I think one of the words too that I think I was using in the last video that I did too, and that you guys have both said today, is giving people grace. Whether that's yourself, whether that's that nurse who's had a horrible day, but giving people grace so that everyone can feel better about themselves. And some of that too might be training also. And I think as we start to talk more about substance use, as we are bringing that more to the forefront now, maybe that will be something too that people are trained a little bit more on how to handle that situation, still with grace with that person who might be difficult, like you were saying, Chris, and that that kind of resonates with me also, with my situation. And that's, sometimes with him, I'm like, okay, yep, I'm sure you're agitated, they're agitated. This is a bad situation in the emergency room to be in, for him and the nurse both, and so I think maybe having people trained so that they do know how to handle those situations, with someone, and realizing, to give that person a little bit of grace. And I think the hope is always when people do come into the emergency room, if they are maybe actively using that, hey, maybe they are going to at some point decide, okay, today's the day I do need help. I need to go into recovery. I need to get somewhere. But that might not also be the case either. But I think giving people grace, and dignity and respect, like you were saying, and self-care is huge. I think nowadays too, people are kind of, worn to the core at this point, with a lot of things. And, but I think also having, I think places also like Wellbeing Initiative that are people out there trying to help individuals and have that experience to be able to help them, whether that's people that are in recovery or people on the other side that we all need training also, on things that we need to be doing or changing. So one of the things I know we want everyone to go on and take the pledge. Chris, why did you want to take the pledge?
Well, because again, I believe firmly that words matter. The words that we choose to use to describe ourselves and to describe others have importance. I believe that our words have weight. And I myself had been trained for a long time to use language that was very stigmatizing. And when I made a decision to watch the way that I speak and to change the way that I refer to people and to myself, I just want to model that. I want to show that there is importance in the language that we choose. And just because you were taught something doesn't mean it's right. One, two, doesn't mean that you can't change.
Mhm.
I've been evolving in my recovery journey, and it's just something that's important to me. The fact that the words that we use do matter. And oftentimes I learned a while back that you don't know what you don't know. And this for me is a way of promoting that, just bringing to the forefront the fact that what we choose to say, the words that come out of our mouth, are important. They do have weight. And I, for one, want to choose language that is not stigmatizing, but that's more accepting and that is more positive in nature, if you will.
Right. Perfect. And Tasia, how about you?
Yeah, I am all for any and every avenue for reducing the stigma. So it is a good reminder. I have it in my office. I just got a frame and it's going to go up in my office. And it's just the reminder to remind myself that, like, I also am not perfect. And I can continue to grow and learn in my words matter, and just continue to use language that supports and fosters a welcoming and supportive environment for people who experience substance use and mental health.
Perfect. Well, thank you guys both so much for talking with me today, and also for helping to get the pledge going, and being advocates also for changing the language that we use. And everyone, go on, look up the Wellbeing Initiative. They have great services, so many services, and you guys are continuing to grow. So there's all sorts of things that you can do at the Wellbeing Initiative, and learn from them. So thank you both for being here, and we will talk to you guys later.
Thanks for having us, Amy. It's a pleasure.
Yep. Thanks, guys. See you later.
Bye.